best in radiology.
This is something everyone increasingly recognizes when they're requesting these tests, is that I would think of it very simply as you're using a very sophisticated camera to take a picture of a moving object. And as you know, if you take a picture of a moving object, it's likely to be blurry. And what we found though is that if we slow the heart down a little bit, it doesn't have to be terribly slow, but just slow enough that we can get crystal clear pictures, the accuracy of our assessment of the artery is much better. But interestingly enough, we also need fewer x-rays just because the heart is not moving so fast. And so it really makes a lot of difference in diagnostic accuracy, the quality, and also giving you as little x-ray radiation as we possibly can achieve. It's very common for patients when they come for a test to have heart rates that's a little bit faster than what we want. And globally we know that we can very safely use medications to bring the heart rate down in a very safe and effective manner. And this is why when you book in for your test, they will advise that you should come in around an hour before. This test itself just takes a matter of seconds, but the preparation for it with the medication can take around an hour or so in most cases. So if you're one of those people who has a heart rate that tends to be above 80 beats per minute, perhaps get in touch with us 3 or 4 days before your test, and we can assess you and see whether we should give you those medications that we can give you a few days beforehand. There are a couple of other things. So we tend to ask people to avoid having a big meal for 2 or 3 hours, and if possible to fast. And that's purely because the contrast agent just very briefly makes you feel nauseous, and that's easier to tolerate if your stomach is empty. We ask you also to try and avoid things that will speed up your heart rate, like lots of caffeine, just simplistically to try and give us the best chance of getting a slow heart rate on when we're actually taking the picture.